It's a great pleasure to welcome you all here for this afternoon session. The session is called Sustainable Financing for Global Health and the WHO, World Health Organization, Approaches, Partnerships and Strategies for a Strengthened World Health Organization. My name is Björn Kümmel and I have the pleasure to chair this meeting. This was not my intention, by the way. We tried to find more capable chairs, but they all said no. We tried two others, and then I had to jump in. So I'm currently the acting head of the Global Health Policy Unit at the Federal Ministry of Health here in Germany. And as mentioned, I am honored to welcome you and many familiar faces I see in the room. I have to apologize that the room is slightly too small for the interest that apparently the audience has. We basically have 1.5 hours for this session. My ministry and Germany overall is a strong supporter of global health and a strong supporter of the WHO. We are supporting WHO wherever we can. The aim of today's session is to look a little bit more into new approaches and strategies to sustainable financing for global health overall, but in particular, obviously, also with regards to WHO. When we are talking about global health financing, we must inevitably consider the WHO. As many of you will know, the WHO has been strongly, underfinanced might be the wrong word, but had a severe challenge and still has a severe challenge of being adequately, flexibly, predictably financed. There's been a long process which more or less ended, maybe not ended, but which culminated in last year's assembly, where a decision was taken to raise the assessed contributions, or to at least in the first step by 20%, and to drive towards the aspiration to reach a 50% financing of WHO through assessed contributions, the membership fee, in order to make it less vulnerable to voluntary funds. But in addition to this financing of the assessed contributions, a decision was taken, or maybe not taken yet, but there was a clear call to find new approaches of financing WHO. So less in a fragmented way, but really in a coordinated way through, and I think that was one of the recommendations of the working group that I had the pleasure and honor to chair, to explore a replenishment mechanism. And my hope is that we will learn a little bit more about this replenishment mechanism, which is not called a replenishment mechanism anymore, but an investment round, which, to my understanding, might be happening by the end of next year. So we will learn about all this. We will discuss sustainable financing, but we will do so in another geopolitical setting, to be honest. Many of the traditional donors face severe financial, fiscal concerns, and also that I think we will be touching in the next 90 minutes. So let me introduce not the audience, but the panelists. It's a pleasure to have you here, and basically all of you I know personally quite well. So let me start with Dr. Katharina Böhme. Katharina is the Assistant Director General for External Relations and Governance at the WHO, and served before as the Chef de Cabinet of DG Tedros. She currently leads the organization's strategic engagement in the areas of governance, resource mobilization, and partner relations. So basically, the AC increase, but also the investment round. But in addition, all the governing bodies are under your leadership, which is quite a heavy task, I have to admit. This also entails providing Secretariat's report for intergovernmental processes mandated by the WHO governing bodies, including those related to governance reform and sustainable financing. Katharina is further active in engaging in multilateral and multi-sectoral partnerships for advancing global health, including with civil society, private sector, and non-state actors. Welcome, Katharina.
Thank you.
Next, I have the pleasure to introduce Dr. Theo Ben Kandetu. He is Deputy Executive Director in the Office of the Executive Director at the Ministry of Health and Social Services in Namibia. And in his role, he serves as the Chief Advisor to the Executive Director on strategies to advance public health and clinical services in the ministry, amongst other portfolios. In addition to his outstanding experience in global health policy, in particular concerning WHO governance and finance matters, Dr. Kandetu is a medical doctor by training, and we are honored to have you here. I personally know Theo Ben because both of us represent our countries in the governing bodies in discussions around financing. So we've been quite active together in last year's PBAC, so the Program Budget and Administration Committee, and the World Health Assembly. So it's a pleasure to have you here.
Thank you.
I'm further pleased to introduce you to Dr. Anja Langenbucher, who is the director of the Bill and Melinda Gates Foundation's European office. In this role, she manages the foundation's policy, advocacy, government relations, communications activities in Europe. Based in Berlin, Dr. Langenbucher leads a team that builds strategic partnerships with various stakeholders across Europe, including governments, civil society institutions, and media. A warm welcome also to you, Dr. Langenbucher. And last but not least, sitting right next to me, we have Laurie Sloat with us today. She's the Senior Director for Global Health at the United Nations Foundation. The UN Foundation supports the WHO as well as other UN agencies and partners that deliver vital services to improve health globally and forge new and dynamic partnerships for health. Prior to her work for the UN Foundation, Laurie Sloat has worked with several UN agencies, and she was the Deputy Director for Advocacy and Public Policy at Gavi, the Vaccine Alliance. Welcome. So let us now dive into the topic of sustainable financing for global health and WHO. The aim of the session is to look at three major points. The first one, why should sustainable financing for global health and WHO be prioritized, given the fiscal constraints that many of our governments face currently? Second, how should a sustainably financed WHO be ensured? And third, what should be done to achieve this? So the idea is to have now, questions. Basically, I will pose questions to the panelists until a little bit before 3. And then the idea is to hear your inputs and questions to the panelists. So we will have a round of questions and answers at the very end. Yeah. So let's start. So in the first block, we will start. Obviously, I have already introduced the theme of multiple crises, scarcity of financial resources, and competing initiatives also in global health, which is a reality. So Katharina, given the economic outlook and the fragmented global health landscape, how can we ensure full financing of global health priorities? And what role should traditional donors play, but also new donors, such as the BRIC countries, could play in global health and ensuring a resilient WHO?
Thank you so much, Björn. And it's a great pleasure to sit here next to so many important supporters of the World Health Organization. Partnerships are in my portfolio, and rallying all stakeholders around global health is also absolutely critical for my work. So with your permission, I will not only speak here about WHO, but really making the case for investment in global health overall. So as you've said, Björn, we are, on the one hand, off track with the SDGs, and we need to accelerate progress against the SDGs. We all live in a dramatically changing environment where, the climate change health effects are already dramatic as we speak, where we live in compounding crises, acute and protracted crises that we need to respond to collectively. We see record numbers in migration and people in need of humanitarian aid, and we don't expect anytime soon the global health financing needs to go down. The slow economic recovery is definitely not making this better. And we've seen in many recent replenishments that the success was only partial. The Global Fund, Gavi, CEPI, GFF replenishments did all not manage to raise to the envisaged targets. The pandemic fund, which was newly set up as a new instrument, basically to support pandemic preparedness and help us create a safer future, also didn't fully live up to what we all hoped for, which was to provide complementing financing, bringing new money to the table. And so all of that is fairly concerning. Now, as you said, Björn, and WHO is no exception to this. In the case of WHO, we get 80% of our funding from our top 10 donors. So we have a relatively narrow donor base. But the same is true for many other organizations in the room. And there's clearly a very big need to broaden this donor base and to lead to fairer contributions from all countries. So how can we get there? Clearly, as you said, Björn, WHO was fortunate with the decision in WHA at our World Health Assembly earlier this year that our member states decided to increase our assessed contributions. And that means they decided to come to the table and all contribute. And that included, of course, all emerging economies. So that, I would say, was an example of success. The pandemic fund also was an example where we saw some BRICS countries, for example, Indonesia, step up and bring financing to the table. So there's examples we can learn from. We at WHO work a lot at the moment to elevate global health at the table because we're already, as we all see, in a neglect phase, right? We are post-COVID in a phase where health is at risk of falling down again. And so, my boss, Dr. Tedros, is working day and night basically to maintain global health on the political agenda in the G20, in G7, in the BRICS agenda, etc. And I do think speaking with one voice as global health community will be absolutely critical going forward. But we also have to think innovatively. Anya is here representing philanthropy. We have to bring the private sector and private wealth more to the table. We see too little of that overall. And we need to work very differently and innovatively with the investment banks, MDBs, etc. I would just want to make it concrete, highlight here two recent examples. We at WHO set up the so-called Health Impact Investment Platform, a very concrete way of bringing new money to the table to health system strengthening, primary healthcare strengthening, which we consider one of the greatest challenges and needs of the next years. And then we just were all at an polio announcement earlier this year for 500 million to polio. Also very innovative, and perhaps Anya will speak more about that. So let me just maybe close by saying, as WHO specifically, we have an annual budget of 2,500 million, which is about the size of the Charité's annual budget. Charité, a famous hospital here in Berlin. But we have 154 country offices and 6 regional presences. So you wouldn't think normally that funding a global public good like WHO should be a challenge, but it is, and even with the assessed contribution increase, it will be. And so, collectively, I think we have to work together in these very tough economic times to sustain the support to WHO, but also to all our critical partners out there and here at the table. Thank you.
Thank you, Katharina. So Katharina has already mentioned the involvement and investment of the private sector in global health. Obviously, one key private contributor to global health is the Gates Foundation. The Gates Foundation contributes, I think at this moment, is the 3rd largest funder to WHO. Dr. Langenbucher, it would be interesting for us to understand how you're investing in WHO. I think there's much, I'm considered to be one of the experts in WHO financing, and I always find the debates interesting. So it would be interesting to understand whether the Gates Foundation provides funding to the base segment, to the core mandate, or rather to specific programs. I think one has already been mentioned. and how you see the possibilities of the private sector stepping up their funding and engagement as partners in global health, and in particular WHO. How do you see the idea of holding this investment round? Yeah, over to you.
Thank you very much. First of all, I can only, support very much Katharina's and Björn's statement on the importance of global health. I mean, I think we are all very clear that we've been backsliding on progress that have been made over the last, years, and that is one of the most dramatic, I suppose, post-COVID impact and world that we still find ourselves into. So I think a lot of time that we're spending as a foundation internally is thinking about how can we increase awareness, how can we point to all the successes that we have achieved over the last years to almost remake the case for global health, which seems to be ironic that we are in a position where we really need to do that. But I think Katharina has put it very well. We are, there are highly other priorities. I mean, we are in a situation of war. We're in a situation of climate crisis. And I think the competing priorities, we're feeling those in the current fiscal environment much more than we have over the last decade. So we are expecting a 50% increase of the funding needs across all of the different multilateral health organizations. And the Gates Foundation has, as part of that as well, stepped up in our own ambition. So we are going to increase our own budget up to 9 billion, which is another 50% increase over the next years until 2026. Now, we're of course not an implementing organization ourselves, and that's part of your question. And we are part of a larger ecosystem because there is, of course, WHO, but there's Gavi, there's the Global Fund, there's CEPI, there are many different very important players within that global health ecosystem that has brought us to progress over the last years. I think to be specific about the foundation support to WHO, which as you say is of course often maybe also often misunderstood, we are supporting the WHO through voluntary contributions to specific projects across a different bunch of areas in health, but also other across different health areas. And it's important to say that these are all programs that have been endorsed, aligned, and strategically supported by the member states. And I think this is an important point that is often misunderstood. Proportionately, our largest contribution is to the polio program because this aligns with one of the most important priorities that the foundation has. As Katharina said, we've just been on Wednesday this week in Brussels and have just signed a very innovative new instrument. And that brings me to my last point. I do think that we need all the funding we can get at this point because I think we've been never in a more precarious situation and at risk to backslide. And we need funding that is not fragmented, that comes from different players, philanthropies and the private sector. WHO has been very successful. I think it's a total 17% are philanthropies of the total budget. And we'd like to increase that. Also learning from our recent funding announced this week in Brussels, I do think we need more flexibility in order to actually receive this funding. And it's fantastic to see what will happen now with the increase of the SS contribution. And I think that puts everyone on a very good and promising path.
Thank you. You mentioned already flexible versus earmarked resources. And I'm coming to Laurie in a second. One of the key challenges for everybody to understand for WHO is that to a large extent, the funding that WHO receives is voluntary and heavily earmarked. There are different ways of earmarking, but one could say that the vast majority of voluntary funding is heavily earmarked, which kind of binds the Secretariat's hands how to use it. So, Laurie, my question to you is, how can unearmarked donations to the WHO be framed as attractive for donors to raise more flexible funding? And the UN Foundation was really key also in helping us, addressing this to member states to increase their assessed contributions to rather provide flexible resources, but here now on voluntary contributions, how to make that more attractive.
Well, I
think there's kind of two parts to that question. One is just to make sure that for people to understand what the flexible and predictable financing would bring to the organization, but then also what specifically would that help to WHO deliver on what WHO does in terms of global health, because there are so many partners. So to get specific on those. And then within that, I would say for the emergencies component, WHO does a great job, responding to increasing needs around whether it's earthquakes or floods or the conflicts that we have today. But the issue there too is around the flexibility of funding. So one of the things for the pandemic, the COVID pandemic, was pretty soon right after it was announced as a pandemic, UNF, UN Foundation, along with the Swiss Philanthropy Foundation, was able to raise about $250 million in very quick succession. But this was because of the generosity of corporations, foundations, individuals from all over the world. But what that provided was very upfront money for WHO to work with its partners to respond quickly for things that were unanticipated. we were in an unusual situation, to say the least, one that never happened before. But it also provided money to UNICEF, about $10 million into the World Food Program because of all of the equipment and supplies that were needed with the planes, right? So another $10 million there. So it was not just about WHO, it was about global health and how do we respond as a world to that. But it was because there was flexible money up front that was not anticipated. That said, with that, I would say, agreement arrangement, there was a very clear strategic response plan that had certain indicators and things that would be delivered. So that made it very easy for us to then report back to the donors to say, here's how your money was spent, here was the impact that it had. So I think that in the case of emergencies, the communication and that type of unearmarked funding, what it can provide is good. But that's one component of WHO's work, because the other, I would say, is around how would this flexible and predictable funding through unearmarked funding capacitate the organization better to respond. So in that, there's two ways to think of that. One is the focus on country presence, right? So this is really going to be a more efficient organization, and we work collectively together to sort of maximize the limited funding that's out there. Capacitating the countries is huge. And so one of the things that UNF did was work with the Civil Society Task Force in 2019. It was kind of the precursor to what's the CSO Commission now, to look at what are some ways, recommendations of how WHO could better engage with CSOs. And one of the biggest findings of those recommendations were that all the CSOs, about a network of 400 CSOs throughout the world, said, we need a WHO country office that has better skill sets to work with civil society in countries. Because think about the impact that has, right? You have help in terms of implementing programs or doing advocacy or whatever, monitoring and accountability, all of it. And then you can actually maximize the work of the CSOs with the country office. So we'd like to see, in terms of the flexible and unearmarked funding, going more towards that skill set that's actually capacitated in countries, because that's where some of the pockets of poverty exist right now. And then finally, I'll just close with the other thing I think that is to try to make the unearmarked money a little bit more sexy. There are some things that WHO does that's not necessarily understood very well by the general public, and I think it sounds really boring and unsexy to say sort of the norms and standards side, right? But that's very important work, and so many people rely on that, the partnerships in the countries. A great example of this is how do you take a product and then have policy recommendations so that it's effective and safe and the standards are set, into pre-qualification and then delivery. So a recent example of this was the Strategic Advisory Group of Experts for Immunization, where there was a malaria vaccine, the second malaria vaccine, which is fantastic. And so there was a SAGE recommendations policy were passed. We're waiting for the pre-qualification of this. But maybe what some people don't realize is that UNICEF cannot procure essential goods like that, like vaccines and medicines, without it being pre-qualified. And then Gavi can also not open envelopes of windows for funding for countries to apply for those vaccines until those things are set. So we really rely on WHO to sort of provide that policy guidance, recommendation, and pre-qualification, and I can't emphasize enough the dependency on that. So I think that's the type of thing. And then there are certain norms and standards within WHO that are not necessarily funded by donors, that it's not earmarked there, so flexible funding and unearmarked funding can go to those areas, maybe sort of in other areas as well. But I'll stop there.
Thank you, Lori. So turning now to Theo Ben. Theo Ben, both of us, we have the pleasure to be the member states representatives on this panel, yeah? When I first took over my duty on WHO, I think one of the first things was to look at the approval of the program budget. This is ages ago, yeah. The budget was then, I think, roughly 5 billion per biennium, and member states easily approved it. And then my question, I was fairly young to the business, and my question was, so we have 5 billion, wonderful. Then I realized, no, it's unfunded. So there's only 1 billion there, 4 billion are missing. And so there was a de-link in between, we approve something and we expect the organization to do lots of things, but there is no funding to it. And so my question to you is, given the current developments that require more predictable and flexible funding from member states, would you say that funding the WHO with real money is a new priority to member states?
Yes, many thanks. Many thanks. Thanks, and indeed you are correct. We have the pleasure of being the member states on the panel here, and so I'm speaking with that in that context. And the simple answer, I think, to your question is yes, absolutely. As member states, as the 194 member states of the World Health Organization, we do think that funding for the WHO is a priority. And it's why we, as member states, came together, formed the working group on sustainable financing, which you so ably chaired, came up with certain recommendations that were really based on our experiences as member states, not just responding to public health emergencies, but also responding to the impacts of climate change, the impacts of war and conflict, and the prerogative of also in that space still delivering equitable and quality essential health services. And with that frame of mind, we realize that the World Health Organization, of course, is central to all of that. It is central to the global health architecture, but we realize that over time it was no longer fit for purpose. It was no longer speaking to the priorities, individual priorities of countries, priorities of regions, and priorities of the organization itself. And it led to a dispensation where we saw chronic underfunding of programs. I think one of the speakers spoke about pockets of poverty. This is really a good illustration of something that was born by the heavily earmarking of voluntary contributions. And so mindful of that, we as member states decided to take a bold decision and change the financial direction, the financial landscape of the World Health World Health Organization by, number one, raising the assessed contributions of member states. And so with that, yes, it is only one way in which the organization receives the money it needs to do its work, but it's an important way. It's a way that fundamentally places ownership of the organization in the hands of the member states, and it's a way that I think over time will lead to more predictability, more flexibility, and more sort of independence when it comes to the financing of the organization. And so with that, as member states have taken this bold decision to raise the assessed contribution, we also now need to come to the table and meet this new obligation that we have placed on ourselves. And so there would be challenges with that. Some of the challenges that I think we need to be cognizant of is that we are all, as a global village, emerging from the COVID-19 pandemic. While we see some economies, some countries recovering economically much better than others, evidenced by, for example, reopening of businesses and so forth. Other countries, particularly developing countries, and more specifically in the African region, are actually seeing a dispensation where there are economic indicators showing that we are headed for a recession. So while the developed countries are starting to emerge, yes, there is still a slow down in terms of economic activity in developed countries, but in developing countries, we're actually seeing a recession. And so this will impact countries' abilities to meet the assessed contribution obligation. I think another challenge that needs to be taken into account is that of debt servicing. And I'm glad, I don't know whether any of you were present in the panel discussion that took place just before this one on innovative financing, but I'm glad that one of the points that the panelists, that one of the panelists made was countries, specifically developing countries, spend much more on servicing debt than they do on health expenditure, and that in itself is a recipe for disaster. And it calls for us to also start, having frank discussions on how we can start to restructure debt. I mean, one example is in sub-Saharan Africa. The debt to sort of GDP ratio has doubled in just a span of 10 years. And it shows you, the limited fiscal space that countries have to then, of course, meet the obligations of paying the assessed contributions. Another challenge I think that needs to be well ventilated is that, again, I'm from Namibia, so the context I bring is that from the African region, and we still are facing a major issue when it comes to financing for health systems, and I'm talking about domestic financing. But we did recognize this in 2001, which is why we decided as member states under the African Union to take a decision to earmark at least 15% of our national budgets to health. Now, this was about 2 decades ago, the Abuja Declaration. Namibia has done well in terms of meeting the commitments under the Abuja Declaration for the past 10 years, but many African countries are struggling. And again, it comes back to the fact that it's because we are spending way too much money on servicing debt than on health expenditure.
Absolutely. Thanks a lot, Theo Ben. So putting this again, because we talked a lot about the AC increase and the obligation. So at this moment, the historic landmark decision in concrete steps meant 200 billion for, And I remember, because we were debating internally, so should we do a press statement because we achieved this increase of 20%? 20% is huge for the UN system, yeah? And I remember our chief of press colleague said, so what did you achieve altogether? So 194 member states for 2 years, 200 million, and that's the success? I can't write a statement for that because it's not, it doesn't sound fine, yeah? So you debated for 2 years to have an increase that achieved 200 million altogether from 194 member states. So what I'm trying to say is, in absolute terms, it's not much, yeah? But it took years to decide this big increase, and we will have further debates coming up because there are further steps, because we are not there with the 50%. Still, it was needed. But in the debates, member states said that we would only get there if some certain conditions, or there was a long debate whether there should, whether we should precondition any increase to come, or whether those reforms that member states are calling for should happen in parallel with the increase. So, Katharina, the question is, what reforms does the Secretariat undertake in order, well, to gain more predictable, sustainable financing? How do we ensure that?
Yeah, thank you so much, Björn. So, maybe quickly to say that these 200 million were absolutely essential for us. And as you said, this was because it's about the flexibility of the funding, right? And just to give you a sense in a nutshell, WHO writes 3,000 grant reports every 2 years. We have a lot of one-year commitments from many of our donors, which means that a large proportion of our in-country workforce sits on hyper-short contracts, in general between 2 to 6 months. That creates huge inefficiencies and ineffectiveness, in particular when it comes to help countries on the ground with their capacities, as you outlined, Laurie. So on the reform effort, when I joined WHO during Dr. Tedros' first term, he had started his transformation initiative, and I came in with this view from many partners, that WHO is too slow in its norms and standards work, the country offices are weak, WHO is not partnering with civil society, and even less so with the private sector. And, I dare to claim that we have since then, together as a WHO team with our member states, improved a lot of that. And I think the challenge ahead for us is to be crystal clear on the progress in our reforms and on the value add of WHO in the global health architecture, in safeguarding our collective future and strengthen global health. So, concretely, our member states have put forward a plan and over 300 recommendations for where we need to reform. We will present to our executive board in January and have implemented 50% of these 300 reform actions. We spoke about the 200 additional million, and it was very important for Dr. Tedros to have invested every cent that we got into stronger country offices, into our countries, because we believe that the impact we need to see that with our country offices and in countries. So that was absolutely critical. You will also see massive progress when it comes to transparency, when it comes to speed in our core functions, especially on norms and standards, bringing tools through the policy process, the PQ process, and all the way to scaling and scale up in countries. And last not least, a quick word on partnership. I hope we have civil society in the room, but we launched earlier this year our Civil Society Commission, which already is contributing a lot to our strategy, to our strategic thinking. We've transformed the way we work with the private sector. So the place to capture all of this will be in our next general program of work, in our next strategy. And we write this strategy and co-create it with our member states. And so that's the place where hopefully, you will see that, that collectively as global health community with our partners, we tackle the challenges that we all see out there today, specifically focusing on accelerating progress and achieving our SDG 3. And you will hopefully see in there concretely the value add of WHO in a concrete results framework, in a concrete results metrics, and then we will use this general program of work 25-28 to work with our member states on the next steps for the assessed contributions, on also the investment round that we're planning for next year, and will demonstrate progress against the general program of work to hopefully convince all our donors that, that we are the player, and we are the institution that they want to see and hope for.
And that you are, by constitution, the directing and coordinating authority in global health, indeed. So the GPW, the General Program of Work, is, I know that my team is looking at it currently, like all other member states, I guess. We will have a proper debate in the regional committees on it, or have had it already, and we will be debating it, I guess, in the board in January, and then hopefully approve something in May next year, right? That's the right term. And then this GPW will be, or the investment round, the idea of holding an investment round is to fill up the finances, the voluntary contributions, I guess, for the GPW term for 2025 to 2028. So basically what is not filled through assessed contributions in the base segment should be filled through an investment round to be held by the end of next year, if member states so decide. So my question to Anja Langenbucher would be, as the foundation is one of WHO's largest external funders, if not to say the largest external funder, if we take member states aside, what would you see needs to be considered in the implementation of the WHO investment round?
Yeah. Katharina made already the reference to the general program, and I think this would be, from our perspective, very important, as you said, to see that that is, well started, well put on track, that it is appreciated and it's approved by the member states, and it is put in practice, and there is a clear strategy on how it's being implemented, because as WHO will be benefiting from an increase of the assessed contributions, I think it will be really important to see that that is put in place well. And from our perspective, absolutely, I think the increase of the assessed contribution is a huge progress. And when we're talking about this, the term sustainable financing, what does that mean? At the end, and that means that you can rely on financing, that you can plan, and that is predictable. And for any company or for any multilateral organization, for that matter, this is the most important thing, to be effective in implementing a strategy going forward. So I think an increase and a further increase of the assessed contribution is something that we will be looking forward to, and hope very much that it will be achieved by the member states, because, as you said, the WHO is at the center of the global health architecture, and so that should be embraced, and that responsibility should be taken on board, that over time the assessed contributions will increase and become that cornerstone of the sustainable financing piece. I do think it is also important to bear in mind that it is an ecosystem. There is the WHO, and there is, we already made reference to this before, there are other organizations, there's Gavi, there's the Global Fund, all of them will be going into replenishment mode. So we need to make sure that in that overall ecosystem we understand sort of, if we go back to basic principles of sources and uses, just as you were mentioning the debt crisis, this is why we are pushing very hard for grant financing and concessional financing for African countries at this point in time that are heavily indebted. The same holds true for the multilateral organizations. We need to make sure that we match the funding needs with the right source of funding. What needs to be funded by assessed contribution, and what can be funded by voluntary contributions, and those need to be made easier to make, and also more easy to receive for the organizations, so we can crowd in more private sector money. I do think the private sector is certainly embracing a different responsibility role. I think that message has certainly hit home that, post-COVID, it cannot be funded only by the public sector. So I think we are there to really have called on the private sector in regards to taking up the responsibility. But now, in terms of how can we receive that funding, we need to just do a little bit more work on make it easy. And so it will happen.
Thank you, Anja. So obviously the announcement of the WHO investment round has also provoked some discussions and criticism, in particular concerning the potential risk of rendering too much influence to private donors. And we also hear that here in Germany when we exchange with civil society, they raise this term, and I think there was even a pushback on the investment round from the very start. Laurie, do you share this skepticism, and what measures could be taken to prevent this from happening?
Well, thanks for the question. I think it's kind of a funny question because I think the intent of the investment round is to actually give WHO more autonomy over its funds, right? So to move away from this model of earmarking where, yeah, there could be undue influence, as some say. But the more flexible you make that money, then the more WHO can sort of address it, as we talked earlier, of where the pockets of poverty are, right? So I think a real beneficial way forward would be like if you take a look at the assessed contributions part, right? And so now you have $200 million, and it's going to be used for flexible, as you were saying, Katrina, reasons. And so one of the things that is happening in countries is that they're actually saying, okay, what are the countries saying? What are they saying that are the priorities that we've all agreed on? But each country is different. So there is a process that's actually taking place now to say, okay, these are the priorities we see it, and it might be very different for the Eastern Mediterranean region than it is, say, for the Africa region. And so what has been happening in the past, because of these short-term contracts and so on, no country office can have a long-term strategy going forward because they have such little staffing in terms of the short-term contracts. But now, with the $200 million, they're actually bringing that to the country offices. As you said, it's one of Dr. Tedros' priorities. So what would be good is to get the story of what that looks like. So when you have that and you're actually able then to have the financing to the priorities that the countries themselves have defined because of that flexible financing, I think that'll go a long way for, that's the assessed contribution part. But then you're making the case to say, okay, for that other half of the portfolio that needs to be filled of the budget, where you have some of the earmarked money, this is why, look what happened with the assessed contributions, so this is why it's important for us to have sort of the unearmarked funding. So I don't think it's necessarily there'll be more influence from the private sectors than others, but the idea is to actually make WHO have more autonomy in that process. But I do think, that said, it goes part and parcel to WHO as the organization itself having to then report back on the results so that we can see how the flexible funding is being used for better efficiencies.
Thank you, Laurie. So, Theo Ben, the main idea, or this original idea to introduce a replenishment mechanism or investment round, came from the Independent Panel for Pandemic Preparedness and Response. And basically the working group on sustainable financing stole it from there, to be honest. The original idea from the IPPPR was to fund, I think, WHO through assessed contributions 2/3. So they were much more ambitious than the working group and member states are, to be honest, and the rest was supposed to be pledged through a replenishment, fully flexible. Yeah, and it would be interesting because we've both been in member states debates at the PBAC and the Assembly, where member states debated. So how should this investment round be held? What about flexibility and earmarked? Could you allude a little bit to that and your position there? Would the entirety of the investment round be flexible, or would it still allow earmarked? What would be your position there?
Yes, many thanks for that question. And indeed, we did have quite a lot of discussion about, initially it was called a replenishment model. And now, as you've indicated, it is an investment round, and it will be the first in investment round, as the organization has envisaged that. Hopefully, not if, when it is a success, that will then be the building block for future investment rounds. So yes, you are right. It is a very important way in which the organization can raise the funds, the flexible funds, the predictable funds that it needs, that will complement the raise in AC. But I think what's important to ensure the success of the investment round and to ensure that the investment round at the end of the day speaks to the 194 member states' priorities, the priorities of the organization, or I should say are a couple of principles. And I think the first one is implementing the framework on engagement with non-state actors, or FENSA, as we call it. I think this is, for those of you who may not know what FENSA is, it's really a framework that is aimed at strengthening the engagement between the World Health Organization and its many non-state actors, its many voluntary contributors, but in a way that, as we've now said, does not leave the organization open to undue influence, does not leave the organization open to non-state actors that may have conflict of interest. And so this is a very important framework, I think, that the investment round should be grounded in. The second one, I think, is that, again, the investment round should be linked to the priorities of the member states. And member states, or not all member states, have the same priorities. One priority in one member state may not be the same in another. A very good example is that of polio eradication. And of course, it's very important, and there are many member states that have already eradicated polio, Namibia being one of them. But that's not the same, or the same cannot be said for other member states where there is a priority to eradicate polio. Same thing can be said about certain public health emergencies, Ebola, for example, cholera, for example. We see it only in certain geographic regions, so that is a priority for that geographic region. It may not be a priority for another member state. And so the investment round, I think, needs to be receptive of the different priorities of member states. And therefore, member states should be part of the conceptualization of the investment round, should be part of the process. And then just the last thing that I would like to close with is, I think, a recognition of WHO's role in the global health architecture. I've said it already, but I think it needs to be reiterated, because I think, as has been mentioned by my fellow panelists, WHO is not the only international organization in the global health space, but we've seen that throughout the history of the organization, it has been quite central in the normative, in setting the global standard, in setting normative guidance. So I think a recognition for that needs to be quite important. So yes, non-state actors could potentially take their money to another organization, but the fact of the matter is the World Health Organization is still the one of the few organizations that is member state led, and that has proven to be efficient, that has been proven to be accountable. And so I think the investment round would also need to use that sort of principle to guide its work.
Thank you, Theoben. And indeed, my understanding is that the Secretariat will come back to member states in its board meeting in January, clarifying the plans for the investment round And I see Katharina is nodding. Okay, very good. So reassured. So although I still have further questions for the panelists, I think it's time now for questions from the audience because we only have, I don't know, 20, 30 minutes left. And the idea is to give you now the floor, the audience. So you have a very nice chair here, but also a very strict one. What I'm going to reject is statements from you. So I'm not interested in your positions. This is a questions and answers round. So you are allowed to ask questions. Yeah. So a question is a sentence, no statements. Because I've been to many World Health Summits before, and people now use this to explain who they are and what their organization does, etc. Whether it's linked to finances or not doesn't matter. And I'm not going to allow this. So with that being said, I'm looking forward to questions from the floor, and I hope I haven't shocked anybody. Okay, very good. There's one question there. And obviously, you're allowed to say who you are.
Hey, my name is Christian Franz. I'm working on global health. I have a very short question to both WHO and to the 2 member states. Do you think you will be more successful in the coming 10 years to get private sector money into global health than you were in the previous 10 years? Thank you.
That was a very great example for a question. So maybe we start with this one because it was so nice. Katharina, I guess it was to you, right?
You can also answer it, but in short, we hope yes. Because we do think, the pandemic has brought a lot more recognition to how critical health is for societies and for individuals. There is no happy and healthy societies without investments and work on global health. Second, the topics and challenges we see, mental health, climate, the need for climate health action, the opportunities in digital health, and more broadly, the opportunities we see in innovation, we see are of great interest to the private sector, and we see that the private sector has changed its view on how to partner and how to come in. So in a nutshell, yes, there's willingness. Also, you've already said this earlier, Anja. We have 17% of WHO's funding come from philanthropy and the private sector. That's significantly more than for most other UN or international agencies. And I think it's due to our very broad vision and portfolio in a certain sense, right? So we do see that there is the interest. What we have to get better at is exactly what you said. We will apply our FENSA rules, our engagement rules, and we will have to mitigate risk and preserve, in particular, our norms and standard work from any undue influence. So it's about partnerships, and we are already, as we speak, much more successfully engaging with the private sector, not only financially, right, but much more beyond. A lot of recent successes in COVID, for example, but also when it comes to, the recent vaccine news, not only on malaria, but also the first WHO-approved dengue vaccine, for example. There is no question that we can do what we need to achieve without the private sector. So the criticality of the partnership and its success will be key going forward.
Yes, Theoben.
Just also, if I can add on to that. So, Christian, I think as you've heard from the WHO Secretariat, they are hopeful. So the answer to your question is yes. I myself, as a representative of a member state, am also hopeful. That we will be able to raise more funds from non-state actors in the next year, in the next couple of years, and I think you've also heard from our colleague here from the Bill and Melinda Gates Foundation that they have also recognized that in a landscape where we all as a global village are responding to unprecedented pandemics like we saw in COVID-19, it left us not just unprepared, but it exposed certain health inequities that have existed for quite a long time that were only brought to the fore, because of COVID-19. And so because of that, you saw that member states, whether they are developing or developed, non-state actors, whether they are the Bill and Melinda Gates Foundation or whether they are pharmaceutical companies, were all impacted. Either lives were lost or livelihoods were lost or economies were impacted. So that is really to say, at the end of the day, the principle here is as we are discussing sustainable financing for global health and the World Health Organization is that if one entity or one member state is not protected, is not safe, then we are all not safe. And so then it becomes everyone's responsibility to ensure that we sustainably finance the World Health Organization in a flexible manner, in a predictable manner, in a manner that is responsive to the priorities and the needs of countries. So really that is just to say you have three panelists now, and I hope Bjorn as well as another member state concurs that we are very we look forward, and we do believe that non-state actors, donors will come to the fore and donate. Yeah.
Absolutely. Yes, donate. No, but I'd like to add something also representing a member state. So interestingly, in the debates on sustainable financing, when we discuss primarily the responsibility of member states keep on saying, no, when we are saying, please give more member states say, well, but let's look into innovative financing and let others, non-state actors come in. Yeah. And we've had that for years in the debates, I would say 10 years, 12 years, and not too many from non-state actors showed up. It's interesting, I didn't know the figure, 17% from the private sector overall, which is much less than lots of people from the general public would believe. But I think, I guess, from my point of view, the investment round would be a complete misunderstanding if we were focusing on non-state actors. It's primarily focusing on member states, and I think there is room for improvement. We didn't discuss that. There was one question that I posed with regards to non-traditional donors. I think that the donor landscape, whether we like it or not, will have to change tremendously, and not only with WHO, but also for Gavi and the Global Fund, because the reality is that within the last 5 decades, the entirety of the funding came from roughly 15 member states, and they will not be the ones in the next 50 years, potentially not in the next 10 years. So I mentioned the word BRICS. The BRICS will have to come in, and they will have to play their role, and they will have to take not only political accountability, but also financial accountability, which at this moment they haven't in the WHO. I mean, I would have to look at the figures, but I did that 4, 5, 6 years ago and counted all the BRICS together, what they contribute and what donor ranking they would have all together, and they came to number 28, I think. All of them to match together. So there is room for improvement, not only on the BRICS, but also other countries. And I think the investment round is a possibility there, not only focusing on finances from non-state actors. So let's see whether someone else has a question.
So much. So I'm Mariam Wallet. I'm indigenous researcher, and I'm coming here listening to you. I heard a lot about non-state donors, But as we are trying to improve and strengthen World Health Organization work and global health, I wonder if any of you states, Namibia have been done well with marginalized groups, which are the indigenous peoples there, and also the donors. I want to hear if there are approaches, new approaches, innovative approaches, also in terms of getting funding to non-state state actors within your countries, because they are part of the chain for the implementation of global health goals. Thank you.
Okay, thank you for that question. I'm not sure who can answer that question. I can't. Anybody here?
Let me take a crack at it. So if I understand your question correctly, you are asking what are some of the innovative ways in which member states also can encourage or support strengthened financing for non-state actors within their countries, if I got you right? Yes. So that is quite a tough one, but I think if I can maybe borrow from Namibia's own experience, for example, in responding to the HIV and AIDS epidemic, or I should say pandemic. So we have employed a whole of government and whole of society approach really in everything that we do, in all the strategies and policies that we set in terms of crafting them and in terms of implementing them. And so one of the ways in which we have been able to support certain smaller non-state actors in terms of implementing programs whose priorities are set by us as a member state nationally is by encouraging bigger non-state actors like the World Health Organization, like the World Bank within the African region, like the Africa Development Bank, to assist us in implementing our programs through implementing partners. And these implementing partners, of course, would be non-state actors who are usually at the subnational level or at the community level. And so this becomes quite important because these non-state actors, for the most part, are a representation of those communities. And so we've seen that programs are implemented better if they are done by the communities themselves. And so what has worked well in our experiences is that type of strategic partnership between bigger, non-state actors that we call to support us in the implementation process by supporting smaller non-state actors at the community level. So I think that's just one way that these smaller non-state actors can be strengthened and empowered.
Of course.
I would just give another example of, again, where it comes in terms of core capacity in WHO offices, but also in the countries themselves. The UN Foundation is part of the Measles and Rubella initiative, and we went with partners to an outbreak that was happening in DRC at the time. And one thing that was very effective was actually for the WHO representative with with the Ministry of Health to convene the bilateral partners in the country itself to discuss what was needed. And also that included some of the CSOs and sort of what was needed in terms of service orientation. So I think one area that's a bit untapped is sort of, we talk a lot about the global financing mechanisms, but in each country, I think it's important to bring the partners together and to have that convening and discussion. So it doesn't have to be an outbreak related thing, but what is the priority for that country, and how can donors in the country, but as well as civil society, be part of that conversation? And I think dollars can go a lot further that way, and that was the case in DRC.
Great. So next question. Does anybody have the microphone? Okay. So already there. Sorry.
Thank you very much. Thank you to the panelists as well. My name is Esther. I'm from Namibia, Deputy Minister for Health. My question, I'm a bit hesitant, but I will put it. There are some organizations that are still contributing to climate change, others highly contributing to NCDs that are having health effects, but these organizations are not contributing to the financial sustainability, especially on the health effects as a result of that. So is this something that WHO, for example, can consider to keep them accountable to contribute financially? I think it's clear. Okay.
Yeah.
Thank you.
Thank you, Deputy Minister. I think you were reading my face when you said it was clear. Very good. Yes, to me the question was crystal clear.
If I were to answer.
That exactly. I wanted to give him the floor, to be honest. But I think it's a great question. The point is that WHO, I think, doesn't have the authority to do that. I guess that member states would have to do that. That's my reading. I guess member states would have to do that. Whether they would find a consensus among 194 member states would have to be seen, I guess. Yeah. But you're pointing your finger into obviously an important point. How do we deal with entities that are working potentially indirectly against our climate and against our health? Yes. It's partly addressed in FENSA, but only partly, and I think climate change wasn't at all included there. Yes, but only partly addressed, to be honest. So sorry for that bad answer. So next question, and I would like to give it to Tim. If we have the microphone here. Because I feel obliged. Tim is also a colleague from Geneva.
Hi, so Tim Paletti, I'm a health advisor for the Australian government based in Geneva. So just a brief question. I mean, listening to the conversation, there's clear recognition that, fully flexible, predictable resources are critical, but there's also a good example of how earmarked resources can make a big contribution to member state priorities as defined in the program budget linked to the GPW. So my question is, going forward, we're likely to have a mix of resources for WHO going forward. I can't see member states agreeing to go to a 100% assessed contribution model, for example. So the question then becomes, what's the level of fully flexible funding that WHO needs to really allocate in line with the program budget? Do you have a sense of, A, what that is, and it would also be useful to monitor that over time, and so how are you going to know when we get to that level? Because that will be quite important for informing the discussions in further resource mobilisation efforts. Thanks.
Thank you, Tim. And that question goes to Katharina.
Okay, since there's so many questions, I'll make it short. But in a nutshell, we don't have a fixed percentage, right? What is important for us is that, we have a fully funded base budget as WHO, and that all our pockets of poverty are filled, i.e. that we have no gaps and we can serve the country needs and their priorities. How we get to, we get to that much more easily and at lower organizational cost with more flexible funding, and we get there at much higher cost and effort with less flexible funding. But when you look at the vision for success of the investment round, for example, right, it's very much about the predictability, right? So it's very much an all pledges count scenario, independent of whether it's earmarked or flexible funding. It's very much about moving to a 4-year cycle over a current, which oftentimes is a 1 or 2 year cycle. And it's in negotiation moving to greater flexibility, right? By making the case, we have very good numbers on what the additional costs per dollar of earmarked funding versus flexible funding is, right? How much that limits us in what we can do. And so we've already, over the last month, had first successes with a number of countries that have decided, based on discussions, negotiations, move to more greater flexibility. So I think, it's not going to be prescriptive, but it's going to be, a discussion. And it's not a hard target, but it's a gradual shift towards that. And it also very much depends in terms of whether we get our next assessed contribution increases, right? And we hope so. But if we don't, then we need much more flexible funding from the investment round. If we get the assessed contribution increases that member states have committed to all the way through to 2030, then that is a big and important contributor to our organizational flexibility.
Absolutely. So that would be also, if I am allowed to add as the chair, there is this heat map. Maybe some colleagues will know that heat map of WHO base. So you can fund WHO entirely. So WHO has, for its base segment, enough resources, but the wrong resources. So there are a couple of programs that are overfinanced, others receive not enough. And the idea was if we made it to the 50% of the base segment funded through ACs, through assessed contributions, then WHO would have the flexibility. We would basically green the entire heat map. Yeah? So all programs would be receiving the funding that they need, not only programs, but also country offices. But we are not there yet. It's an uphill battle until 2030, I guess. So we have one more question, I would say. So at the front here, I would, yeah.
Yeah, thank you. I try to consider the criteria you set for asking questions. Katrina, you said the funding to WHO is voluntary by the donors. I was struggling to understand how the voluntarily funding works. How are there some conditionalities or conditions attached to the funding coming from the donors? And if there are, how do you balance between those conditions and between the priorities in the countries and between the situation in the countries? I come from Afghanistan and I work for the health system in Afghanistan. WHO is managing half of the public funding coming from World Bank. But there are huge restrictions on women. There are obvious disparities in terms of access to healthcare. How it could be difficult for WHO to balance between these two, and how it will affect the sustainability of funding, specifically in situations like Afghanistan.
Thank you for that question. Katharina again.
Thank you. So definitely, in order for WHO to accept funding, we have rules and we have standards, including ethical standards. In terms of your specific comment on Afghanistan, I think I have many UN colleagues in the room, and we assess this situation weekly, and we look at it weekly. And as WHO, we have maintained our response in Afghanistan because we feel we would harm the people, and we meet with the authorities and the Taliban there because we feel if we don't engage, we will make things worse. So we fight and continue to fight and raise our voice for the rights and status of females, for example. We have done our best and raised our political voice for making sure that females can continue to work in the healthcare sector, can continue to go to school, can continue to work everywhere. I think we've lost some battles collectively there recently, but we will not abandon the people in Afghanistan. And most of our UN partners have taken a similar decision, right? Because this would lead to a breakdown of health systems locally. Thank you.
Thank you. So we've come to an end of the questions and answers session, and thank you Well, keeping to the criterion that I said, and obviously the very valid questions, great exchange. We don't have the time for lengthy statements, but only for one take-home message. And let's start with Anja.
Take-home message for sure. I mean, as the title suggests, I think we've made lots of progress in defining what we mean by sustainable, and I think that's what we should keep in mind going forward, increasing constantly the assessed contributions and making sure if you want to attract voluntary contributions, including from the private sector, it's not wrong to think about incentives. How do you get them to come on board, and why, and what are the criteria that should be front and center? And then think about sources and uses, what funds which best. I think this is the most important thing going forward.
Thank you. Lauren?
It's kind of what you said, Bjorn, at the beginning of when you came to understand WHO and that there was only $1 billion of $4 billion there. I mean, that's crazy, right? Like what company would start any kind of budget cycle not having enough money in its coffers, so to speak? So I think the one thing about the investment round to understand is like, while it would be great to increase the overall amount for WHO, that's not the primary objective in terms of increased funding. It's the increased quality of those funds. And to Tim's point, I think it's true that I don't think you're going to say, okay, we want fully flexible financing for, say, the 6 strategic objectives. But what we are saying is, well, should we fund malaria in XX country? So we have to have a progression of which those buckets are that should be funded. Maybe it's malaria in the first year. Maybe it's communicable diseases in year 4. Maybe it's, there's a progression there, and that's the dialogue that's happening now. But really the take-home message is it's much more about the quality of those funds so that there can be more flexibility to respond and not just the overall increase. So if private sector is coming on board, the challenge is not the money that they're bringing in, but the type of money that they're going to bring in.
Great, thanks a lot. Katharina?
So, I've discussed recently together with Dr. Tedros with a lot of heads of states. And what gives me hope is, and I'm speaking here specifically also to the many partners I see in the room, is that a lot of the political leaders out there say health for all, and working on global health is a priority for us. And we see that no matter which country, no matter which continent, and no matter whether it's the global north or the global south we talk to. And so, let's work collectively on that as partners. For us at WHO, this investment round is not a purpose to cannibalize others. It's not to cannibalize Gavi. It's not to cannibalize Global Fund. It's actually not to get more funding. It's about getting greater predictability and flexibility in funding and improve the quality. And it's to keep health and global health on the political agenda. And that's probably its single most important cause. And that's why we will aim for a head of state level meeting with this investment round. And last not least, I think that, WHO, in its funding model is actually beautiful, right? Because it's about all contributing, all benefiting, and all deciding. And I think because of that, this investment round and the fact that we want everybody to contribute fits 100% in the financing reform that is ongoing out there in all the discussions we have with countries.
Thank you. Theo Ben.
Yeah, I have the unlikely distinction of being the last one. So all the good points have been expounded on. Yeah, no, but just really quickly, and I will try to be brief, and also just building off what Katharina said. I think there has to be a recognition that in sustainably financing the World Health Organization, whether it's member states who are providing the financing or whether it's non-state actors who are providing the financing, there must be a recognition that in the sea of organizations in the global health space, you can bet your bottom dollar that you will get value for money if you invest in the WHO. And so hence the centrality of prioritizing funding to the World Health Organization. And then the other thing I wanted to just mention was we've also spoken at great length about how, yes, there are these two funding streams, the assessed contributions as well as the voluntary contributions. But I think what has become clear in the discussion is that both member states and non-state actors are committed to seeing a fully flexible and fully flexibly financed and fully predictably financed organization. And we are committed towards achieving that. But there are certain incentives, as was mentioned, that also need to be part of the equation to make it more appealing, more sexy, for us all to invest in the organization. And one of that, as was mentioned, is the governance reforms. If we as member states or as non-state actors want, if there's an obligation placed on us to give more in terms of money, then we need to be assured that the WHO will be able to fulfill its role in terms of meeting the priorities of the countries. And so with that, we want to ensure that WHO is in a space to increase the accountability to member states, to increase the efficiency in all that they do, increase compliance, and of course increase inclusivity in not just in budget setting, but also in the financing, in the programmatic work, in the administrative work of the organization. But I'm very hopeful. Yes, you indicated that it may be an uphill battle, but if COVID-19 has taught us anything, it is that we need to pull together. We need to come together. We need that global solidarity, that global cooperation to ensure that we are better prepared to respond to the next outbreak, health outbreak. Thank you.
Thank you, and indeed, my script says, Chair, now closing words, prospects, and takeaways for the work of the Ministry of Health. So I'll do my best to do this within the remaining 2 minutes. So the first thing I'd like to do is to really applaud the panelists. Thank you, Anja, Theo Ben, Katharina, and Laurie. It's been a real pleasure, and it's been a quite frank and direct conversation among us. I think this is what I like, why I like the World Health Summit, because we can be frank and we can debate, and it's not about harmony here on stage, but rather also to have intellectual fights. Yeah, we didn't have intellectual fights now. Yeah, but at least potentially we came from different positions and we shared our views here. So this is really what we believe the World Health Summit needs. Yeah, because often enough, in the Geneva settings, we are all applauding ourselves in harmony, but in reality, there are also different positionings, and to be in a position to really frankly debate and to see how we can move things together. The next thing I'd like to do is to thank the audience for your patience and your great questions. It's been a pleasure to have you here and to host you here in this room. Are there take-home messages for us? Yes, there are. So first of all, this is not a scientific debate that we are having. This is really politically highly important for our day-to-day work in Geneva. This is ongoing work. We will have the EB coming up in January, where Theo Ben and myself will have the pleasure to discuss these things further and trying to move it further. Not all member states are convinced that we need an investment round. I think ours are, and we will do our utmost to move this forward together with the help of civil society and the private sector. But also this other track, the ACs, I think need further work. It's an uphill battle, yes, but we won the first uphill battle, and I mean, we need to win another of further uphill battles, but I'm quite positive that we will do that all together with your help. So thank you very much, and it's been a pleasure. Until next time.